Stephanie, and I'm going to do a head-to-toe assessment and look for any abnormalities today. Can you tell me your name and date of birth?
Kaylee Kendall, 9984.
Can you tell me the month and the day?
February 10th.
Okay. She's alert and oriented ×4, and her mood and affect and dress are appropriate to the situation. Your gait and balance were steady when you walked in. Do you have any past medical or surgical history?
No.
Allergies?
No.
Current medications?
Nope.
We took your vital signs earlier, and your blood pressure was 115/62. Your heart rate was 78, and your respirations were 16. Temperature was 98.2. Your height was 5'5", and you're 150 pounds. Your weight is proportionate to your height, and your waist-to-hip ratio is less than 1, which is normal. I'm just going to feel on your head. Your hair is dark, smooth, no lesions, and your head is normocephalic. The skin on your face is warm, pink, and dry. Can you smile and frown? Puff out your cheeks. Okay, and your facial expressions and features are symmetrical, and that's testing cranial nerve number 7, the facial nerve. I'm going to do a sensation assessment. Just tell me what it feels like and where it's at.
On the right, it's firm. Soft on the left. Firm on the left. Soft on the right.
Okay, and that's testing cranial nerve number 5, the trigeminal nerve. I'm going to pull down your eyes. Okay, your sclera are white, and moist, and conjunctiva and lacrimal puncta are pink and moist. Earlier we assessed your visual acuity with the Snellen chart, and you stood 20 feet away, and your right and left eyes were 20/20, and both together they were 20/20. If you want to close one eye, we're going to assess your peripheral vision.
No.
Okay.
See it?
Okay, and it's testing optic nerve, which is cranial nerve number 2. If you just want to look straight ahead, I'm going to look in your eyes. And if you want to look here and follow with your eyes and not your head. Okay. And then look here and at the wall behind me. Any good? Okay. Perla is intact with accommodation and no nystagmus noted. And I was testing oculomotor, trochlear, and abducens nerves, cranial nerves number 3, 4, and 6. I'm going to look at your eyes with the ophthalmoscope. I'm going to hold it 12 to 15 inches from your face and come in from the side of your line of sight. Okay, your retina and optic disc are intact without bleeding. I'm going to palpate and let me know if there's any tenderness.
No tenderness.
Okay, and your frontal, ethmoid, and maxillary sinuses are without tenderness. Your nose is symmetrical and midline and proportionate to face. If you want to tilt your head back, I'm going to look in your nose. Okay, your mucous membranes are pink without drainage or redness. And if you want to include one side, we're going to do a smell test. Or if you want to go ahead and blow. And then include the other side. Okay, and then include one side and close your eyes and tell me what this smells like.
Cloves.
Okay? And this?
Alcohol.
Okay. And your turbinates were pink and bilateral without swelling, and your patency, your nares are patent, and that's testing olfactory nerve number 1. Your mouth is, or your lips are pink and midline and symmetrical. If you want to open your mouth, I'm going to look inside. Okay. And then bite down. Okay. If you want to stick your tongue out and wiggle it side to side. Okay, and that's testing cranial nerve number 12, the hypoglossal nerve. Your teeth were white and without caries, and no gingivitis was noted. Your tonsils were present in a +2. Your hard and soft palates were present, and buccal mucosa was moist and pink and intact. When you bit down, that was testing the trigeminal nerve number 5. And if you want to swallow, okay, and cough, and it's testing the glossopharyngeal and vagus nerves, cranial nerves number 9 and 10. Earlier we assessed your taste, and that was assessing the facial and glossopharyngeal nerves, cranial nerves number 7 and 9. I'm just going to look at your ears and let me know if there's any tenderness.
No.
Okay. Your ears are symmetrical and the skin is pink, warm, and dry. They're uniformly shaped and set above the eyes. I'm going to look in your ears. And I'm going to pull back your pinna. Okay. The external is pink and moist, or pink and dry without cerumen. No lesions or redness noted. The tympanic membranes were shiny and transparent without lesions. We're going to do the Weber and Rhine test. I'm going to put this on your head and tell me when you don't hear it anymore.
No.
Okay? And then behind your ear.
No.
And to the side.
No.
Okay?
No.
Okay.
No.
Okay. And that was testing your hearing, and that was the acoustic nerve, cranial nerve number 8. And I'm going to palpate your lymph nodes, preauricular and postauricular, and these are occipital, submandibular and submental, anterior cervical and posterior cervical, supraclavicular, and your trachea was midline. Was there any tenderness?
No.
Okay, if you want to push against my hand, okay, and the other side, okay, and then push up against. Okay, and that's testing spinal accessory nerve, cranial nerve number 11. You had full range of motion in your neck and adequate strength. If you want to turn your head to the side, the other side, and tilt it back, okay, and there's no nuchal rigidity or JVD noted. I'm going to palpate your underarms if you want to lift one up. Okay. Any tenderness?
No.
Tenderness?
Nope.
Okay. Do you do monthly breast exams?
Yes.
Okay. Remember it's important to do it a week before your period, after your period. If you're, I'm going to look at your arms. The skin on your arms is pink, warm, and dry, and your trigger is immediate, and your cap refill is less than 3 seconds. If you want to rotate your wrists, okay, and bend your elbows, rotate your shoulders. Your range of motion is full, and if you want to grab my hands, okay, release, and pull back, okay, and push, okay. And your strength and muscle mass is adequate. If you want to pump up your hand, we're going to do the Allen's test, okay? And then I'm going to hold here, and then we're going to drop it and release. Okay, and it was positive. And again. And release. Okay. And your Allen's tests were positive. I'm going to feel for your pulses here. And they're equal bilaterally and strong. And I'm going to feel your pulses in your neck. Okay. I'm going to listen. I'm going to listen to your head. Okay. Your carotid and temporal arteries were without Ruiz. And we're going to go ahead and do reflexes. This is your bicep reflex, and your tricep reflex, and your brachioradialis. On the other side, brachioradialis, bicep, and tricep. And there is no swelling noted on your arms. We're going to do the sensation test again. Do you want to close your eyes and tell me what you feel on which arm?
Sharp on the right. Soft on the left. Sharp on the left. Soft right.
Okay. I'm going to listen to your lungs and your heart. Listen under your shirt. Deep breath. Deep breath. Lift up your shirt. Deep breath. Okay, I'm gonna listen to your heart. I'll listen under the shirt. Is it aortic, pulmonic, Erb's point, tricuspid, and mitral? And the S1 is heard loudest at the mitral, and the S2 is heard loudest at the aortic or pulmonic. And I'm going to listen to your apical while I feel your carotid. And they were equal. Your respirations were 16, even and unlabored. If you want to turn around, I'm going to listen to your lift up your shirt. Okay, you just want to breathe normal. Okay, and then say 99,
99,
99,
99,
99.
99.
Is there any tenderness here?
No.
Okay. And your lung sounds were clear and breathing was even and unlabored. If you want to go ahead and lay down. I'm going to look at your abdomen. Lift up your shirt. Your skin is pink, warm, and dry. I'm going to listen. In all four quadrants. And your bowel sounds are normal, active. Do you have any nausea or vomiting? And your appetite's okay?
Yeah.
Okay. So your nutrition is probably adequate. If you ever have any pain in your abdomen, the doctor might do percussion to feel the size of your organs and see if they could locate where the pain was coming from. The skin on your legs is pink, warm, and dry, with no viscosity is noted. If you want to rotate your ankles and bend your knees and your hips, your range of motion is full. Okay, you want to push against my hands? Okay, and pull back. Okay, and do you have diabetes?
No.
Okay. The turgor on your skin is immediate. The cap refill is less than 3 seconds. And the skin on the feet is pink, warm, and dry. If you had diabetes, then it'd be important to look at your feet every day because you can lose some nerves in your feet. I'm going to feel your pulses, your legs. Feel them popliteal, and the posterior tibial, and dorsalis pedis. If you want to sit back up on the edge of the bed, we're going to do reflexes. Okay, and this is Achilles and patellar, and patellar, and Achilles. Do you have any questions? If you want to close your eyes, I'm going to do a sensation again. Tell me what you feel and where you feel it.
Sharp on the left. Sharp on the right. Soft on the right. The left soft.
Okay. Do you have any questions?